Let's talk about deep hip rotators, what they are, what happens when they're tight. So deep hip rotator tightness can really cause a lot of pain and wreak a lot of havoc and misery in people's lives. But I find that if you can really dig in, all puns intended, and understand them a little bit better and how they work, then it becomes a lot easier to fix that tightness. So deep hip rotators connect our femur, all right, into our pelvis, into our sacrum. So when we think about deep hip rotators, we think about things like obturator internus, obturator externus, piriformis, those deep muscles that sit underneath your glute max. So when you think you have maybe that burning pain in your bottom when you've been on a road trip and you're sitting in the car, or maybe when you sit down you feel a little bit more fleshiness underneath one ischial tuberosity than the other. Maybe you've been told you have obturator tightness because you've been to see a pelvic floor PT. Maybe you have one side of your pelvic floor that doesn't contract as well as the other. So deep hip rotators are both pelvic floor muscles, so they're the deep muscles in the pelvic floor that help to support the organs, but they're also hip muscles. Okay, so when we look at these muscles, I think it's really cool that we can address the pelvic floor from the hip. I think that kind of gives us a little fun cheating window to get in there. So when you think about your deep hip rotators, they help to rotate open your femur. They help to turn your femur out. So can you imagine if these deep hip rotators were tight? So imagine my hand is a deep hip rotator muscle. When you have tension in that muscle, you can see how it would create that deep tension down in that glute area as it kind of holds on, and it would feel like it's hanging onto your hip as well. So you would have hip tightness. So things like pigeon pose would feel very, very tight and restrictive for you. And it can also cause that tightness in the pelvic floor as well and pain there. All right, so when you look at that deep hip rotator tightness, you want to think about the effect it has on the hip as well as the pelvic floor. So when our hip tends to sit in that more externally rotated state with somebody constantly putting tension or pulling on it, then you see how this could shove the femur forward in the socket, which could then disrupt how our hip is moving, which can then lead to hip pain and tightness. All right, the sciatic nerve runs between the belly of the piriformis muscle in a lot of people, so sometimes it can cause that numbness and tingling down your leg. Sometimes it just causes like a deep ache or deep pain as well. So those deep hip rotators have a wonderful purpose to be able to help control our hip in the socket, but sometimes when they're running the show, they can cause pain.